Hello and welcome to the Success Showcase. I'm your host, Eric Lopkin with the Modern Observer Group. And with me, as always, is Chip Janiszewski from the Happiness and Success GPS. Chip, how are you doing this week?
Doing great, Eric. Happy Monday. How are you?
Doing fantastic. We're finally getting a break in the heat here in the Northeast, and we might even be getting a break in some of the rain we're getting.
Yeah, I'm looking out my deck and I don't see any water on it. That's unusual.
It's been that kind of a summer. There's been a lot of rain. We're still better off than the Northeast has been. They've been having ridiculously high temperatures and wildfires. So our thoughts and prayers go out to them.
Yeah, absolutely. But the stats came up and we're over twice the average amount of rainfall for July by far, and it's only July 19th. So that's how wet it's been.
Yeah, I'm actually not complaining too much about the rain because my lawn could still use a little more water. So, as long as I don't have to deal with it, let it go.
Yeah, I like cutting the grass in July when it's cool.
Right. And again, as we always say, you don't have to shovel rain.
No.
So we've got our special guest today, Jennifer Tirillo. She is a health and wellness expert, and I'm going to let her tell about her specialty and what she does. So Jen, welcome to the show.
Hey, thanks, Eric. How's it going, Chip? Thank you guys so much for inviting me to come and talk with you today. I'm excited to be here, and all this talk about weather has me really craving some sunshine. I can't believe we're mid-July and midway through the summer, and I feel like the sun has been missing from my life here. My name is Jen Tirillo. I am a licensed athletic trainer, and I'm also a registered yoga teacher, strength and conditioning specialist, and I do a lot of work with the way that the human body moves. And I am the owner of Concentric Care, and my business was founded back in 2019 after some nudging from some of my colleagues to kind of push me in a direction that's kind of always been in the back of my mind, but never really fathomed that I could be a business owner. So here I am today, and I'm excited to talk with you both a little bit more about that and what I do.
Fantastic. Now, again, you said you're a licensed athletic trainer, but you don't just work with athletes. You also work with everyday people who've injured themselves and have other needs.
Right. Our name of the profession of athletic training, that name is really, really tricky. And historically, athletic trainers, yes, typically worked with athletes. Our profession is a little bit on the young side. It really was recognized in the 1950s. And athletic trainers, again, were seen with, athletes on the sidelines, football games, basketball. And it was typically a male dominated profession. And here we are in 2021, and over 60% of athletic trainers are now female. And you make up a really good point that, athletics is in our name, and that's where I found my professional roots. I spent about 14, 15 years working traditionally in sports. The setting was really high school athletes. And I was fortunate enough to have a very long career working in the secondary school setting as an athletic trainer and doing things just like that, on the sidelines, on the bench, on the field, and working with those high school athletes to either assess their injuries, lower their risk of injury by, providing education, by providing, injury prevention exercise. And then if they do happen to get injured, then they were in my office after school and before their practices where I could tape, I could stretch, I can teach them different rehab techniques, teach them about nutrition, teach them about anatomy and physiology, why their body hurts after, a vigorous training session. So there was a lot of face time that I've had with young athletes over that time. And I'm so happy that you pointed out that athletic trainers don't work with just athletes. We are fortunate enough to work with people of all types. Most people who get kind of like attracted to working with an athletic trainer generally are physically active in some way, shape, or form. But I have worked with youth athletes, middle school, high school athletes, collegiate athletes. I've worked with, your quote unquote weekend warriors, runners. And I've also worked with just human beings who move their body, enjoy going out for walks, taking their dogs out, going hiking, just really fun recreational activities. And maybe they're experiencing some sort of pain in their body and they don't know how to navigate that. Is that something I need to go to the doctor for? Do I need to go, to physical therapy? And they're not really sure. Absolutely. I can see those kinds of individuals, and I'm more than happy to see those types of individuals. I really genuinely enjoy helping people. And I knew from a very young age that I wanted to be in healthcare. I knew I always wanted to, help people live healthy lives, whether it was, through being a nurse. That was my first kind of interest when I was thinking, gosh, what do I want to be when I grow up? I had thought about the nursing field and considered physical therapy when I got a little bit older into high school, and eventually found my way to athletic training. And here I am. I get to have these wonderful interactions with all sorts of people, and I help them sometimes through challenging experiences when they're either injured or in pain. And if everything goes well, then we get them back to doing what they love to do and what makes them truly happy.
Yeah, I'm doing the research, looking at your website. You work person to person, you assess everybody. I like the question of ready to get back to the activity or sport that you love without nagging your chronic pain. But looking through this, I became educated. You have, you have the sentence in there that says, if I told you that there are 0 pain receptors in your body, what would you think? And then you go on to say your body is equipped with specialized cells to detect changes in your body systems, and bodies don't like change, just like minds don't, obviously. And I love the last sentence, and you talk about chronic pain. It says, chronic pain arises when this cycle of fight or flight becomes a sequel to the movie of Groundhog Day with Bill Murray. Can you stop the cycle? Yes. So talk about that, because I think that these words, they educated me, and I'm sure they will educate a lot of people out there and give them a lot of hope.
Yeah, I mean, sometimes those words are a little bit mind-blowing, and it comes down to a few different things. When you work in this profession, not just athletic training, when you are in the realm of healthcare, you have to embrace the concept that things change. And, even in my, short career, I guess, in the long grand scheme of things, I've been doing this for 17 years, but even since my education, things have changed. And what I might have learned in my undergrad education may have evolved. We might get more science, more information. And for me, I'm a lover of learning. I really enjoy, reading or seeing what other practitioners are doing. And in the realm of chronic pain or even injury, gosh, it is such a complex thing. And, you brought up the point about pain receptors in the body. People think I'm nuts when I say you don't have pain receptors in your body. And they're like, well, what are you talking about, Jen? Something hurts. It's painful. Well, I guess I would answer it this way. Say the three of us, we all go out to have lunch. We all leave the restaurant and we all step off the same curb. We all misstep at the same time, right? We have this incident where we have an injury. So we'll say we all sprain our ankle. God forbid, I don't wish that on anybody, but we all trip off that curb and we twist our ankle. Well, my experience and Eric's experience and your experience, Chip, are all going to be completely different. And they're not wrong. Not one is better than the other. Not one is going to be a worse experience than the other. We're all going to feel different things. My ankle might swell. Your ankle might not do a darn thing. And, Eric might be in a boot for several weeks. And, in terms of the actual sensation experience, there are so many different factors that play into how a person experiences pain. That pain experience is very real. So don't let me mislead you with those words in thinking that pain is not real. It's just in your mind. No. Pain is very real. It's just that there is not a cell, if we were to kind of look at things under the microscope, that is identified as that is a pain cell. that doesn't exist. So pain is determined by your previous pain experiences, stress in your life. Think about it. If you're having a really crummy day or something happened that makes you really kind of on edge, if you have achy, sore muscles, tension in your neck, it's going to feel worse, right? So we have several factors like that. We have things like, your diet, nutrition, your level of hydration, your experiences with previous injuries, right? How many times have you heard of maybe a family member that tore their rotator cuff? And as soon as you maybe feel a little bit of shoulder pain, what's the first thing that you're going to think of? Oh gosh, did I tear my rotator cuff like, Uncle Mike? Oh my gosh, am I going to have surgery? Oh my gosh, I'm going to be out of work. I'm going to take time off. And it spirals into this big thing. So our experiences with pain, either personally or with, a family member or a loved one, it really shapes our pain experience in general.
Yeah, it's a lot like going online and trying to diagnose yourself by reading WebMD. You're convinced that the sniffles are fatal. Yeah.
Yeah, step away from the WebMD. I mean, that was a common statement in my athletic training room back when I was, in the prep school setting is, okay, did you Google? Step away from the Google.
Yeah.
And you'd have an athlete that comes in and they give you all of these symptoms that lead you to believe that, okay, this person swears that they tore their meniscus. And so they looked it up and they have all the signs and symptoms. And so they say, Mrs. Tirillo, this is what's going on. I have clicking, I have locking. I know I tore my meniscus. They come in convinced. So that's why, and it's hard. We're human. I have kids. I have Googled. I don't recommend it. So it's just, we're human beings. We want answers and we want to know, because when we don't feel right, we want to feel right like yesterday. We don't like not knowing what's wrong with our bodies.
Yeah, and that changes from day to day, obviously, and really, I mean, minute to minute. Eric and I talk a lot, obviously, about life being a series of present moment events, and we also talk a lot about mindset, which I'm sure that you talk a lot about when you're dealing with your patients, because your mind can be your own worst enemy when you get swayed by Dr. Google and all these other things out there.
Right. You are 100% right. And now that I'm in my own private practice, I work with clients in an integrative fashion, meaning sometimes when we're in that true orthopedic setting, there's limitations. There's time, there's personnel limitations. I didn't obviously take insurance when I was working in a school. I was hired by the school to do the work. But if you're in, an orthopedic practice, there might be limitations with insurance. So you have some challenges when you're working with people. And the beauty of, having my own practice is I can do it what I feel is the right way. And mindset is huge. If I have a person who wakes up every day in pain and it just, has a terrible effect on their mood, they wake up and they're just sad. And, their outlook is negative, and, no one can help me and I can't get better. And I know I need to move, but I can't move because it hurts. Mindset it trumps everything, before the orthopedic stuff, before you start to integrate, therapy and rehab and exercise. You have to really, really look at mindset first, because that brain is going to dictate everything.
Yeah, I noticed you're a yoga instructor too, and my wife does a whole lot, and obviously that's a huge part of that also, relaxing the mind.
Yeah, 100%. And, I integrate yoga a lot. I mean, it was a personal thing that I chose to do, after having children. We all need to slow down. And I've always been one to overload my plate. How much can I do? I function the best in chaos, to be quite honest. And, we're in this go, go, go culture that having that balance of yoga is is for me a huge benefit. And in the right circumstances, I love to introduce others to it, being present and mindfulness and breathing. I mean, breathing is huge. And going back to people who experience pain on a day-to-day basis, or even, on a regular basis, are dysfunctional breathers. That could be a whole other podcast discussion, is dysfunctional breathing, because so many of us need to get to the fundamentals and actually check in with how do we breathe. Yes, it's automatic, but it doesn't mean that we're doing it effectively. So breathing is huge. Mindset is huge. Slowing down is huge.
Yeah. You've used a couple of terms, and I just want to get back to this and clarify. What, if anything, is the difference between what you do, physical therapy, and rehabilitation?
I love that question. That is wonderful. And, Chip, you had mentioned there's so much education on my website. It's my passion. I love teaching people either about their bodies, about how things work, and I love talking about my particular profession. When I was in school, it is a bachelor's degree program. It has now moved to a master's degree, 5-year to 6-year program. We are licensed by our state in many states. Connecticut is one of them. And we also must be certified through a board exam. Physical therapy is a bit broader than what athletic trainers do. And in many instances, we collaborate and we do work together. Many athletic trainers will work in a physical therapy clinic. That actually was my first job out of college. And, it depends on the athletic trainer that you talk to. I would like to think that the athletic trainer's biggest claim to fame is acute type care. I'll give you an example. If we are at some sort of activity or event and someone gets injured, we are going to be the ones that are going to feel the most comfortable approaching that individual and dealing with that acute scenario. Personally, I would not feel comfortable in a hospital acute setting, whereas a physical therapist would shine in that type of setting. So there's a lot of crossover. In terms of rehabilitation, I mean, that's more semantics more than anything. One of our core skill sets is rehabilitation, just like a physical therapist. One of their core skill sets is rehabilitation. So there's definitely some crossover, in terms of physical therapy and who they might see as clients. They might see, Medicare. I cannot see Medicare patients. Okay. Athletic trainers in Connecticut do not have third-party reimbursement for insurance. So unless that individual is open to doing out of network in a cash pay scenario, which why would they if their insurance is covering everything? I wouldn't work necessarily with a Medicare patient. So I guess to answer the question, it's kind of a lengthy one. We have a lot of crossover. Both professions have skills that are a little bit more are niche more than anything. And I think one other point would be a personal trainer. A lot of times I'll explain that I'm an athletic trainer, and they either will think physical therapy realm or a personal trainer. And there's also a distinct difference between athletic training and personal training as well. We do have, the educational component is a little bit different. We have a 4-year, if not master's degree. We have specialized training, and we're dealing with injuries, whereas a personal trainer you're typically going to see in a gym setting, or, working with, wellness and health, but it's pretty much that's it. We're more broader in the sense that we can do health and wellness, fitness type training. It's not necessarily our niche, but we can also work with individuals who are injured and safely get them back to their desired goals, their daily activities with safe exercises, progressions, and so on. How does that sound? Does that help?
It does.
All right, perfect. Good.
Now, you also mentioned that prior to going into business for yourself, you worked in the school system as an athletic trainer.
Yeah.
Did you have any experience dealing with concussions?
Oh, of course. I mean, you can't not get away from concussions, particularly if you are working in a traditional sports setting. Over the past, duration of my career, I mean, the knowledge, the science, the understanding of concussions has evolved exponentially. I mean, even how we handle concussions, we went from, the earlier days of I got my bell rung, which we don't like that phrase in athletic training. We don't like it. It kind of devalues the actual injury that is happening in the brain. And we went from treatment like, no electronics, no technology, essentially sit in a dark cave for a few days, allowing the brain to heal. And now our research is actually showing that for athletes, there's benefits to getting them moving at a lower threshold of intensity. It will help their healing process. So no, we wouldn't want to put them in a game, a football game or a soccer game, but even in the first couple days post-injury, once they've had their initial symptoms in the first day or two, which really kind of peak, getting them on the bike for really low intensity exercise, that's normal to them. For an athlete, they're exercising, they are practicing and training most days of the week. And when you take that away, it actually is more detrimental. So we continue to evolve how we treat concussions. A lot of it is education, getting parents and coaches to understand that their understanding of what concussions were from when they were growing up is vastly different than how we look at them now. Again, moving from that concept of having your bell rung, walk it off, kind of ideal, to, hey, there's no takesies backsies when you have an injury to your brain. You can't undo that. You can't, if you hurt your knee or hurt your hip so many times, yeah, sure, down the road you can get a knee replacement or a hip replacement. You don't have that luxury with the brain. So you have to kind of acknowledge those micro traumas because they add up. They're cumulative over time. So we're definitely more mindful about concussions. You can see them in athletics. You can see them in the workplace. You can see them in, other realms that athletic trainers work, like police, fire, performing arts, public safety. I mean, we're embedded in so many different professions that, concussions can certainly happen anywhere.
Yeah, we've seen a lot of about concussions in the headlines, and especially with football. But if somebody is sending their child to school and the child says, I want to be involved in football, I want to, be involved in these sports, what should a parent know about concussions? Rather than, I've heard a lot of parents just panic going, no, you can't play that. I don't want to risk it. Realistically, what should the parent know?
Well, I think one of the biggest things that parents should know is, yes, you should have an understanding about concussions, about what cumulative head injuries can accumulate to. We're still looking at things like that. There's tons of stuff if you're looking at Alzheimer's and tau proteins, and they're linked to concussions. Again, that stuff is always evolving. But for a parent who, and it's not necessarily just football. I mean, there is high levels of concussions in other sports. It just depends on reportability. How often are they getting reported? The biggest thing I would suggest to parents is the coach trained? Meaning, CIAC requires coaches to now go through concussion training. Not all youth sports require that. So is the coach current on their understanding of concussions? What are the signs and symptoms? How do they handle concussions? The next thing I would always suggest is technique. What kind of drills are occurring at practice? So football is a great example. There's a drill called the Oklahoma drill. That one is pretty much kind of been kicked to the curb. Like, this is probably not an appropriate drill, especially if you're, 11 years old. We don't have any business, running head to head. It's just not a good thing. So knowing that the coaches are well versed in concussion education, that they're teaching proper technique regardless of the sport, and that there is access to some sort of healthcare professional. This is my shameless plug that parents should be asking for an athletic trainer at their children's sporting events, because we are trained to identify, to assess, and to make the proper judgment call as to what happens next, particularly with concussions, but also orthopedic injuries. You're seeing us at more and more high schools, which is lovely, but we don't see athletic trainers as frequently at big club sporting events, big youth sporting events. That's still something that, as a profession, we're working on getting more athletic trainers in those settings. So as a parent, definitely ask questions. Is there someone on site to help take care of my kids? And it should be an athletic trainer.
You mentioned the CIAC. As far as going over these things, do you actually, or do people like you, do programs where you get all the coaches from all the schools together, sponsored by an organization like that, for the good of all sports there? I think that would obviously be a great thing to be doing if it's not happening right now.
There is to an extent. It really depends on the relationship that the athletic trainer has with the particular school. So CIC in particular, the heads up training is required. So coaches have to do it. But if you're looking, at our youth levels, there is no requirement per se. But the idea of community service and teaching those things, people like me or an athletic trainer, we would be the perfect person to do that kind of education. I think that's a wonderful thing to do. One of the barriers, I think, is time, number one, and two, sometimes financial, and three is just logistics, trying to get parents all in one space. So my suggestion to that is that every season of sport, doesn't matter if it's fall ball, if it's, spring football, if it's off season soccer, there should always be a pre-season meeting with all the parents, with the coach in the same room. Let's talk about the logistics, about how much fun we're going to have and how much you're going to learn this season playing whatever that sport is. But hey, let's be proactive and let's talk about taking care of our bodies and how to stay on the field. Because at the end of the day, that's what athletic trainers want you to do. We don't want to pull you. We want you to play your sport. We want you to do your activity. But that proactive education, I think, is truly priceless. So I think that's a really, really a great point. Thank you.
Now, we've talked a lot about the athletic trainer side, but you're also a yoga instructor. How did you make that transition and get into teaching yoga?
Great question. Personally, I began practicing it myself, and I wanted it as a way to kind of balance out the craziness and busy lifestyle that I was living. And I specifically got trained to bring it to my athletes. And so I did the training. I have my 200-hour registered yoga teacher training, and I began offering it at the school that I was working at. And I was shocked at how quickly it caught on. So my personal practice evolved into integrating it into my athletic training role. I was able to introduce, high school kids into, yoga, and they loved it. They really, really loved it. And I think that's one of probably the biggest, how do I even word it? One of the most satisfying things about being a yoga teacher is I like introducing people to it. They have this preconceived notion of you're sitting in this crazy pretzel shape and you're chanting Om, and there's candles everywhere. And trust me, we're all guilty of what we think yoga is. And it's all about making it approachable and digestible to more human beings. And I don't know, it's just a joy to be able to get people to have an opportunity to kind of check in with what's going on in their body. Because a lot of times we shy away from that. We stay busy. We try to jam pack our schedule. We don't know how to just be in our own bodies and breathe. So that's where it came from. I integrate it actively, with my one-on-one clients if we're doing corrective exercise or working through pain and injury. And then I teach every Sunday and try to get more people, little dip their toes in the yoga sand. And more often than not, they're like, hey, I actually kind of like this. This is a good thing.
Fantastic. Well, we are just about out of time. So if our listeners want to get more information about what you do, how can they get a hold of you?
Yeah, I would love to continue the conversation. I really appreciate you both inviting me to do this. I am super duper active on social media, so you can certainly follow me on Facebook and Instagram at Concentric Care CT. And I also have a website. It is concentriccarect.com. If you're ever interested in yoga, I teach on Sundays at Balance Massage and Wellness Center in Newington. And I also have hours at Elite Soccer Performance in Berlin, where I see athletes and active individuals. I'm all over the place, guys. If you can't find me, I'm telling you. But I'm telling you, social media is probably the best way. And then also check out the website. So I appreciate that. Thank you.
Great. So, Chip, what do you think is the big takeaway for our listeners this week?
I love the proactive, educational approach to this whole thing. As I said, I learned so much just by reading your website. The bottom line out there for you Google people, Google's not a fix it for everything. It's more like a body shop and an auto car. But if you want to fix something else, you got to help out too. And what we have that Google doesn't is a mind. And you're teaching us, well, number one, how to understand this in the first place, but how to use it. Because obviously we're partners in this. It's not like you're telling us what to do, and if we do it, it's going to work out. That's just not the way things work. So we're blessed with a mind. We got to use it, and I love the mindfulness approach.
Thank you, guys. I appreciate that, Chip.
Yeah, I think for me, the big takeaway is, we do talk a lot about mindset, and there's so many of us that just tend to forget about the messages our bodies are sending us. And it's important that we pay attention to our bodies. I'm guilty of this. Most men are guilty of this. We'll hurt something. We'll, get sick or something. We'll go, oh, I'll be fine in a few days. And we ignore it, and it's something we actually need to pay attention to. So I think that's an important takeaway, is that mind and body have to work in concert, and we have to pay attention to what both are telling us.
Yep. I love it, Eric.
You've been listening to the Success Showcase. You can catch us every week at xvadio.com/podcasts. You can also find us on the Apple Podcasts app, Google Podcasts, Spotify, iHeartRadio, Stitcher, Amazon Music, Audible, and wherever you find podcasts. Remember, make this your best week ever and make next week even better. We'll see you then.